If you are opening the Beaufort County Community Street Resources Directory, you are likely already in a difficult situation. Staring at a massive list of phone numbers and agencies while trying to manage a personal emergency usually just leads to paralysis. The county actually has a highly comprehensive safety net in place. There are programs covering everything from mental health interventions to utility assistance and emergency housing. But that abundance comes with a steep trade-off. Navigating dozens of overlapping agencies and trying to decipher acronyms like DSS, BATS, or IAFT creates a massive access bottleneck right when you need help the most. To get past that bottleneck, you have to stop reading the directory like a static phone book and start using it as a triage framework tailored to your specific situation. This diagram untangles that web of acronyms. We can categorize these resources into 3 parallel pathways: immediate crisis, basic needs, and specialized care. Knowing which path to take drastically cuts the bureaucratic friction standing between you and the help you need. When resources and time are limited, survival doesn't come from having a directory of 100 different numbers. It comes from knowing the exact 3 numbers that apply to your specific level of urgency. Let's start with the immediate crisis pathway. If you are facing a mental health or substance abuse emergency, the baseline response is to dial 988 or the IFS mobile crisis line. Calling IFS triggers an immediate 24/7 in-person intervention. Taking this route successfully deflects you from facing medical debt at a hospital emergency room, but you will have to navigate a specialized behavioral intake process instead. If the danger is external, like domestic violence, you need protective emergency shelter, such as Ruth's House or the Kelly Center. These protective services guarantee immediate access to a confidential, highly secure location, 24 hours a day. Achieving that level of physical security requires a heavy trade-off. You have to immediately relocate, which causes a severe disruption to your daily routines, your work, and your family schedule. This scorecard shows how effective crisis triage works. You must match the exact nature of the danger, whether it's an internal health crisis or an external physical threat, to the correct immediate responder. Moving to the basic needs pathway, the most common systemic friction point people face is simply getting enough to eat. The zero-barrier option for this is walking into Zion Shelter and Kitchen. You can get a hot lunch daily without filling out a single piece of paperwork. Soup kitchens solve today's hunger immediately, but they do not provide a stock of groceries to get your family through the rest of the week. This comparison table shows the trade-off between low-barrier soup kitchens and bulk grocery options. Food pantries offer higher food yield, but introduce higher friction. They require strict adherence to limited operational windows and reliable transit to carry groceries home. If you don't have a car, calling the Beaufort Area Transit System, or BATS, solves that mobility gap. Utilizing BATS means sacrificing on-demand flexibility, as you are required to schedule your ride well in advance. The friction scales up even further when we shift from immediate basic needs to long-term infrastructure, like applying for HUD-subsidized housing through Mideast Regional or the Washington Housing Authority. Housing applications carry an extreme friction-to-reward ratio. You achieve permanent living security, but you have to endure the highest administrative hurdles and navigate long wait lists to get it. Navigating your basic needs requires a constant calculation. You are continually trading immediate walk-in flexibility for long-term volume and stability. Next, we look at empowerment resources. These are services designed to elevate residents out of systemic reliance by providing connectivity, job placement, and legal aid. This chart plots administrative effort against impact. In the low-effort, high-impact quadrant, the Affordable Connectivity Program provides subsidized internet via simple online verification. Moderate-effort, high-impact vocational resources like NC Works demand consistent in-person engagement. Finally, high-effort, extreme-impact programs include legal aid and free Medicaid assistance. The trade-off for this level of legal and medical advocacy is steep. You get life-changing professional intervention, but you have to supply meticulous administrative documentation to make your application succeed. Climbing out of systemic poverty requires strategically spending your limited budget of administrative energy on the programs that yield the highest return. Generalized systems often fail populations with unique friction points. That's why the directory points to highly specialized support nodes. For seniors, utilizing the Mid-East Commission Area Agency on Aging or the Long-Term Care Ombudsman usually requires the caregiver, rather than the senior themselves, to initiate the advocacy. This matrix pairs demographics with community hubs. Spanish speakers connect with bilingual liaisons to bypass language barriers. For autistic youth, ACEs for Autism and Teddy Bear offer therapeutic support, requiring strict scheduling. To balance this, parents utilize Boys and Girls Club programs. For specialized demographics, browsing a general directory rarely works. Success relies entirely on finding the single correct human liaison to circumvent the broader system. Attempting to memorize a 14-page directory during a crisis guarantees confusion and wastes critical response time. Instead, use this collapsed 5-point cheat sheet of gateway numbers as your ultimate triage solution. Saving this condensed list to your phone ensures you can instantly route yourself to the correct service node without the cognitive overload. You sacrifice knowing every minor program listed in the directory to guarantee your connection to the major hubs. Once connected, they can refer you to the specific subprograms you need. For acute, life-threatening distress, bypass all directories entirely. Dial the IFS Mobile Crisis Line or 988 immediately. If you are dealing with non-lethal systemic friction, like needing emergency food, housing, or help with utility bills, your first move should be dialing NC211. This connects you with a professional navigator who will handle the bureaucratic maze on your behalf. True community empowerment requires action. Having a clear, zero-hesitation map to access these resources exactly when you need them is far more effective than just possessing a massive list.